Welcome to Lecto. Today we are going to discuss edema. Edema is basically the accumulations of the fluid in the interstitial space of the body. There are several causes of the edema. In this lecture, we will discuss how edema is formed in the body. Before we discuss the formation of the edema, we first of all discuss its mechanism. Let's start. Here you can see this is the portion of arterial, then this is the portion of the capillary, and last is the venule. And the blood flow from the arterioles and exit from the venule. This space is actually the interstitial space. Here you can see this is the interstitial space. And this is the lymphatic duct, lymphatic system. Actually, when the blood flow from the arterioles, fluid from the blood move into the interstitial space due to the hydrostatic pressure. Hydrostatic pressure. The pressure generated by the water is called hydrostatic pressure. So due to the pressure of hydrostatic, the fluid will move from the arterioles into the interstitial space. And then fluid move into the capillary where different material exchange. The rate at which the fluid move outward is equal to the rate at which the fluid move inward. It means in the capillaries, the rate at which the fluid move outward will be equal to the inward. But in the venule, due to the proteins present in the blood vessel, proteins are not actually moved from the blood vessel into the interstitial space, but some amount can move. But majority of the proteins present in the blood and blood cell remain in the blood vessels. But due to the protein present in the blood, a pressure is generated which is called colloid osmotic pressure. And due to the colloid osmotic pressure, the fluid which move from the hydrostatic pressure will move backward into the venule due to the colloid osmotic pressure. So it means the amount of the fluid which will move from the arteriole will also move backward into the venule. It means the net is zero. This is the normal situation. If we enhance the hydrostatic pressure, then the fluid will move into the interstitial space. Then a disturbance occurs in that case. And another case, if we decrease the colloid osmotic pressure, it means the fluid which is present in the interstitial fluid will not move back into the venule, and due to their blockage, then fluid will accumulate in the interstitial space and cause edema. This is the two case. First case is the increase in the hydrostatic pressure. Second case, if we reduce plasma colloid osmotic pressure, it can also cause edema. Third, actually this is the normal mechanism. The interstitial fluid which is present in the interstitial space also move through the lymphatic duct, and through the lymphatic system it will again move into the blood through the subclavian vein. So let's suppose if the lymphatic duct blocked by any reason, and due to their blockage, the fluid which is present in the interstitial space cannot move back into the blood. So due to their blockage, it can also cause edema. It means if the lymphatic obstruction occurs, it can also cause edema. Fourth is the sodium retention. It means we will discuss it later so you can easily understand what is mean by sodium retention. Next is the inflammation. In case of inflammation, that normally the endothelium cell through which the blood vessel form is normally close together. There is no enough distance between the endothelium cell. But in case of inflammation, the space between the cell enhance, endothelium cell enhance, and more fluid will move into the interstitial space. This actually because in that situation, inflammation, white blood cell also move from the blood, move into the interstitial space for the destruction of the any pathogens which is present in the interstitial space. So it gives benefit that if the endothelium space increase, then more fluid move and along with the white blood cell. So this is in case of inflammation. This point is very much important. Now we see hydrostatic pressure increase in what situation? The question is that in what situation hydrostatic pressure increase? It increases in two situations. Impair venous obstruction, it means the blood from the veins do not back into the heart, and in arterial dilation. Impair venous obstruction occur in two situations, in cardiac failure and venous obstruction. Venous obstruction can be of two types. It can be through the thrombus. Here if you see that this is the blood vessel. If the thrombus form, then it blocks the blood. And second one is the compression. If you can see, this is the blood vessel. If there is a tumor over the blood vessel, then it compresses the blood vessel and reduces size, reduces bore, and due to their reduction, then venous flow or impaired venous obstruction occur. In arterial dilation, it means in case of heat, arterioles dilate and remove the heat from the body. So, but we have now we discuss cardiac failure. How cardiac failure cause or increase hydrostatic pressure? Because this is very much important and this is very complex process. So keep stay with me. Cardiac failure. In case of cardiac failure, heart is not pumped properly, and due to their failure in pumping, it causes reduced cardiac output, and due to the reduction in the cardiac output, it stimulates a system which is called RAS. RAS is basically a renin angiotensin aldosterone system. What is that system? Actually, here you can see this is the nephron. This is the nephron, and here you can see this is the glomerulus, and just near the glomerulus there are cells which are called juxtaglomerular cells. actually these secrete prorenin. These cells secrete prorenin. It will convert into the renin, and it will move into the liver and result in the formation of the angiotensinogen. Angiotensinogen. Here is the liver involvement for the formation of the angiotensinogen. Angiotensinogen convert into the angiotensin 1 with the help of the lungs, because lungs secrete angiotensinogen converting enzyme, and after that angiotensinogen 1 it will convert into the angiotensin 2. This is very much important. Angiotensin 2, it performs two functions. Angiotensin 2 perform two functions. Angiotensin 2 to perform two functions. It compress the, actually this is the afferent arteriole and this is the efferent arteriole. This compress the afferent arteriole and reduce the blood to the glomerulus, and due to their reduction less filtration of the blood occur and less urine is produced. It means that angiotensin 2 involved in the urine reduction in the urine output. It means after the reduction of the urine, then the blood volume will increase. Second one is the angiotensin 2. It results in the production of another hormone which is called aldosterone. Aldosterone, which is actually produced by the adrenal gland, which is actually present over the kidney. Aldosterone causes two things. It actually absorbs the sodium ions at the distal end. Actually, in the nephron, this is the proximal end and this is the distal end. Aldosterone acts on the distal end and causes absorption of the sodium ions from the tubules into the blood. And when the sodium move from the tubule and move into the blood, then after that the water move along with the sodium, along with the absorption of the sodium from the distal end, water also move in the blood, and due to the movement of the water into the blood volume increase. So it causes it, if the volume in the blood increase, then hydrostatic pressure will also increase and causes the edema. If the cardiac failure is consistent, then through the positive feedback more edema form in the body and general edema form overall, which is also called anasarca. So if we cure the cardiac failure, then it results in the normalization of the general edema produced in the body. So this is how cardiac failure causes edema. Next is the plasma osmotic pressure, which is occurring in different situations. Nephrotic syndrome. Basically, in nephrotic syndrome, the filtration of the glomerulus enhance. And glomerulus filters proteins in the urine. It means in urine you can see different proteins. Normally proteins are not present in the urine, but in nephrotic syndrome proteins release from the blood and we can see proteins in the urine. So in that situation the protein present in the blood reduce, and due to the reduction of the protein in the blood, then the colloid osmotic pressure is also reduced. And this is basically a complex case that if you see that I'll show it here so you can easily understand what I'm trying to understand you. Actually, this is a membrane. This is a two beaker, and in between them there is a membrane. Actually, there are some proteins present in the right side, and here there are a lot of proteins present in that situation. And here you can see this is the water molecules present in that side. So what do you think that in what situation water move from the right side, or you can say left side, to the right side? In both situations water will move, but in what situation excess water will move? In case 1 or in case 2? In case 2, if the proteins are in large amount, then large amount of water through the osmosis will move from left to the right side. But in case 1, low proteins are present in the right side, then low water will move from the left side to the right side. So this is the same case. If the proteins are in normal or excess amount, then more water will move from the interstitial space into the venule. But if the concentration of the proteins in the blood vessel reduce, then it causes reduced colloid osmotic pressure, and water will remain in the interstitial space. So this is the nephrotic syndrome. In liver diseases also, for example, liver diseases, cirrhosis, the protein concentration also reduce because liver produce a lot of proteins. In malnutrition, if a person doesn't take enough proteins in the nutrients, then it causes the reduce in the protein in the blood. And gastroenteropathy, if the proteins in the GI tract is not properly absorbed, then it also causes reduction in the proteins in the blood vessel. Next is the lymphatic obstruction. In case of inflammation, here you can see the fluid from the interstitial space move back to the blood through the lymphatic system. If the inflammation occur in the lymphatic, then it causes the edema. Why? I'll give you an example so you can easily understand what I'm trying to teach. In case of filariasis, this is a parasitic infection which is caused by the Busheriae bancrofti. This is a parasite which reside in the lymphatic system. In what part of the lymphatic system? In guinal region. In guinal region. Actually, here you can see this is a person, and this is the inguinal region of that person, and there are a lot of lymphatic ducts present in it. It resides in the, here you can see this is the lymphatic duct, and this parasite reside in the lymphatic duct. It causes fibrosis. It produces fibrosis in the lymphatic duct. Fibrosis. If the fibrosis form in the lymphatic duct, it blocks the lymphatic duct, and when the lymphatic duct is blocked, it causes edema. This is the case. In case of neoplastic cancer, let's suppose in case of carcinoma of breast, carcinoma, I write it here, carcinoma of breast. In case of carcinoma of breast, the lymphatic duct, here you can see this is the lymphatic duct. If the cancer block the lymphatic duct, then it can cause edema. In case of breast situation, in case of carcinoma of breast will look like a pouch orange appearance. Pouch orange, look like a peel of orange, skin of the orange, just like that. There are several petite-like structures. Breast. And last is the post-surgical and post-radiation. If the in mastectomy, removal of the mast, in surgical procedure, breast is removed in case of female. In that situation, due to the surgery or irradiation, the lymphatic duct is damaged, and due to the damage of the lymphatic duct, it causes in the formation of the scar form in the lymphatic duct, and due to the formation of the scar in the lymphatic duct, it also blocks the lymphatic duct and also causes the edema. So this is lymphatic duct obstruction in case of inflammation, in case of nephrotic, neoplastic cases, and in case of post-surgical and irradiation. Next is the sodium retention. As I tell you, RAS system, this process is same in the sodium retention. If the sodium retained in the blood vessel, which causes the water move from the nephron into the blood and increase the blood volume, and due to the increase in the blood volume, hydrostatic pressure increase and causes the edema. And last is the inflammation, which I have told you about the inflammation. In case of inflammation, endothelium cell space is enhanced and more fluid will move from the blood vessel into the interstitial space and causes the edema. So this is all about the edema. If you have any question, then you may ask in the comment section. Thank you.